very much people are coming to you as well, when maybe they've been told by other doctors that they shouldn't be trying with their own eggs anymore. They should be going to donor, or even they shouldn't be using their own worm. Worm?
I
No one
like
should be
worm.
using it. No one should be using a worm.
There
Listen,
might be one thing that could be referred
said
to
the
as a
wrong
worm,
word.
but
There's
that's a
not a
different
new fertility
conversation for.
treatment. Right. Yeah, own womb, womb. Welcome to the Embrace Fertility podcast. I'm Naomi Wolfson. I'm a trauma-trained cognitive hypnotherapist, and for over a decade now, I've been supporting women both emotionally and energetically to conceive, carry, and birth the babies that they long to hold. I personally went through infertility myself, and it was after a failed treatment round and having a panic attack on the London Underground that led me to retrain in the amazing mind body techniques that I share now with women across the globe. I'm the founder of the Embrace Fertility Method, which leads women through my unique program of comfort, coping, connecting, clearing, and creating to create the lives that they desire. In today's show, I'm interviewing Dr. Aimee, the Egg Whisperer. If you have not heard of this amazing lady, then hold tight because this episode is a whirlwind of both information and inspiration. Dr. Aimee is a fertility doctor in the San Francisco Bay Area, and for the past 16 years since starting her practice, has become a global phenomenon in the world of fertility. She has the Egg Whisperer Fertility podcast, which has had over 3 million downloads. Her approach is very hands-on and approachable. We're going into detail today. She graduated from UCLA School of Medicine and completed her residency in OB/GYN at Harvard Medical School. She also completed a fellowship in reproductive endocrinology and infertility and holds a master's in public health management and policy from the University of Michigan. Today, Dr. Aimee's global platform is known for sharing a message of fertility, hope, and positivity. And let's dive into this amazing episode. So, welcome to the podcast. And this all started when one of my lovely clients introduced us. And I've put here to what she put with, and as an even shorter introduction, Dr. Aimee, the egg whisperer and wise anchor in the wild sea of IVF, basically the queen. And I was like, right, hang on. And I'd obviously already heard of you, was already following you on Instagram, and we're very interconnected within the fertility world. And then the more clients I've had that are patients of your lovely self, and heard about the way that you work, and the way that you work is just so different from many other doctors. So I actually asked my clients, well, actually, let's start with, how did you get the nickname the Egg Whisperer?
Well, it was a patient of mine who gave it to me as a gift. So she was ready to give up. And I said, no, no, not quite yet. We still have one more try. Long story short, she got pregnant. She actually ended up with twins. And then as a gift, she said to me, you're my egg whisperer. I don't know what you're going to do with this, but I bought you the website, eggwhisper.com. And then it turns out she was a vice president at a news station. And she was at one of my egg freezing parties. So I started egg freezing party back in 2014. And she came to my first one in San Francisco. She actually helped me produce it. And Fox News was there, 2020 was there. And she just whispered to all of them, that's my egg whisper. That's my egg whisper. And then the title and all the articles on Good Morning America was, Dr. Aimee, the egg whisperer, throwing egg freezing parties. So I credit her for the name. It wasn't something that I used to describe myself, but she very kindly thought of me in that way, and it kind of stuck.
Oh, amazing. And I think like it's interesting. So I put out a little reel today saying that I was going to be meeting with you today. And I've had three of my clients message me who aren't working with you and literally going like, oh my God, I'm obsessed with Dr. Aimee. Oh my God, I love her podcast. Oh my God, I get this. Everyone is so excited. And they're like, oh, and I think there's that because so many doctors are kind of so separate and keep themselves like apart or kind of on this pedestal. Whereas, like you said, you're running the egg freezing parties, you have your podcast, you're running classes every few months, literally talking directly to people. Um, and what led you to working in that way and doing it so differently to so many other people?
You know, it was how I was raised. I mean, my grandfather would do house calls. My father was a part of this community. Actually, he saw patients in this very office, exactly where I'm sitting for 40 years.
Wow.
So for me, medicine isn't about, call my office and set up an appointment and I'll answer your question in 2 months. It's here's
Yeah.
my cell phone number. You have a question, call me, text me. I literally have a sign that says keep calm and email Dr. Aimee that people see as they leave my office. And when I was trained by a fertility doctor who did the same thing, he gave every single patient his cell phone number. And I just saw how less stressed they were, knowing that if they had a problem, they had direct access to somebody. So I kind of modeled how I set myself up by watching him. And the thing is, like, giving people your cell phone is not that big of a deal, right? But for a lot of doctors, they don't want to have that much of a connection to their patient. Other doctors say things to me like, Do, don't you think that they're going to abuse that? And no one takes advantage of the fact that they can call me. I actually tell people there's only going to be one time where I could ever be mad at you. And that is if you have a question and you didn't ask me. I say, you are not allowed to go to YouTube. You are not allowed to go to
Yeah.
Google. You have to come to me. And the thing is that maybe like 3 to 5 years ago, doctors used to say things like, don't replace Google with my medical degree.
Yeah.
Things have shifted, Naomi. Now the shift is, why are you asking me that question? Go to Google, right?
Yeah.
Google it. And that's not what people want. People want personalized care and advice now more than ever because there is so much information online and it's hard to really figure out what truly applies to you or not. I mean, I definitely recommend that people do their own research. I tell people ChatGPT is a great place to get accurate fertility information. It really is. Like if you want to figure out like what's the difference between a controlled cycle and a modified natural cycle, put into ChatGPT and you'll get really nice responses that are actually quite accurate. So I'm not going to be replaced by ChatGPT anytime soon. Until then, I still want my patients reaching out to me.
And I think that's the difference, isn't it? It's like, and I've definitely found that with the clients I'm supporting who are your patients, that the fact that it's an ever-changing situation as they're going through the cycle and test results come back and suddenly everything shifts and dates shift, and being able to literally, message you, reach out and get that sometimes even, instant response or a very quick response back compared to the clients I'm supporting who, yeah, have to log into a portal, book in a time to have a phone call or send an email. It will respond after 48 hours. And like you said, the amount of additional stress that's being put on them, because sometimes things have shifted so much, the drug doses need to change, but they've missed the window and the whole cycle goes out the window.
Right.
Whereas with you, things are changing all the time. And one of my clients said that something she really appreciates so much is the fact that you will always give her a straight answer. And it's always like, if I was in your shoes, this is what I would do. So it's not like, oh, you could do this, or you could do this, you could do this. Because the whole point is they're looking to you and they want your expertise and they want your opinion on what they should be doing. And there's something so um, gives people so much more confidence in themselves if they have someone else having confidence for them.
Oh, that is so true. And I literally, when I meet with someone, I look at them and I think of them as a future parent. And I know that they're going to get there. I feel it down to my core that I will do everything possible to help them and hopefully we will get there. But at the same time, sometimes the journey has to change. We have to pivot a little bit. But if people have someone that believes in them and believes that they will be successful no matter what, they can keep going, right?
Yeah.
They will have the energy and they will know that there's always a plan for them and I will be able to guide them. Otherwise, they feel lost. They don't know what their diagnosis is. Doctors ask them questions like, well, what do you want to do next? And that's not fair to ask a patient. I mean, certainly it's nice to be asked what you're thinking. And I do ask my patients, what are you thinking as far as next steps? What do you think is best for you? But at the same time, I also want to provide them options so that they can evaluate based on what their preferences are, what we should be doing next.
What do you think? I know very much people are coming to you as well, and maybe they've been told by other doctors that they shouldn't be trying with their own eggs anymore. They should be going to donor, or even they shouldn't be using their own worm. Worm?
I like worm.
No one should be using a worm.
There
Listen,
might be one thing that could be referred
said
to
the
as a
wrong
worm,
word.
but
There's
that's a
not a
different
nutrition
conversation for.
treatment. Wrong. Yeah, own womb. Shouldn't be using their own womb and should be going to surrogacy. And then they come to you, and then the miracles happen, and they're either getting pregnant with their own eggs or with donor, but using their own body. What sets you apart? Like, why do you think these other doctors are going for like stopping that genetic path sooner than you do?
Because I have the patience and I have the energy to do so. And I'm very competitive. And when I hear that a patient's told that the only way you can get pregnant was donor egg, what I like to do is say, well, let's think about what the positives are, what we've learned so far, what you haven't done yet, and then evaluate what those things are and see if it's something you want to consider. I mean, there are certain patients who should certainly consider egg donation. You're not making mature eggs anymore. They're mature, but they're not fertilizing. They're fertilizing, but embryos are not growing. You know, if you've done at least 3 cycles and you're seeing that type of outcome over and over, it's a sign, you know, especially if you're over 41. But for younger women, you can have a bad cycle. It doesn't mean you need to move on to egg donation. It just means let's try and be a little bit more creative. And there are things that I feel comfortable doing that other doctors don't yet because maybe there are not enough studies for them to consider doing it. So, what I'm talking about are procedures like ovarian rejuvenation or using different supplements or adding HGH to the protocol or adding rapamycin for 2 months. You know, there are certain things that I feel very comfortable doing, not just with IVF, but also, like you mentioned, for patients who are told that surrogacy is the only way. The way I see things, it might be the way we need to consider, but you still haven't tried the recurrent implantation issue. I hate the word failure protocol that I
Yeah.
use. So let's try that first. And also, it just depends on how many embryos a patient has. I mean, if she's done 6 cycles, has one embryo left, and she's 47 and has already done 2 or 3 transfers, then it might make sense to move on to a surrogate, even if you haven't tried my protocol.
And I think that's the difference, isn't it? It's like treating each patient as their own individual person. Because so often I feel that a lot of the time people will need to feel that they have tried everything before moving to the next step. And sometimes that's not possible. And obviously, we always have that time constraint with fertility. And sometimes I say, look, you don't need to be 100% on board of the next step, whether that's the next step in treatment or the next step like going on to a donor or whatever step it's going to be. You need to be 51% on board and get it going. And sometimes then you don't have the time to grieve the step that you're moving on from, but you can be aware that you can allow that to come a little bit later, but sometimes you need to be moving on. But if
Hmm.
you really understand why you're moving on, so like you said, you're really assessing, is this best for you or is this best for, I feel that some doctors are making decisions to get the best results for their clinic. And so they're like, oh no, look, you're 41, you know, stop doing that. It's like my client Beth was told, like, right, you should just stop with your own it, just go to donor eggs. And they're pushing her. And she just held fast and she was like, I just don't feel ready to take that step. I'm just not there yet. And she ended up having her daughter at 42 and her son at 44, both naturally, but using the protocol of natural killer cells, the steroids. Um, and she looks back and she was like, no one had the faith until she found the right doctor. No
Right.
one had the faith that that was possible with her body. And then she found someone who had the faith in her. So was like, right, bring it on. Let's do this. So then got the result.
Nice.
So when someone comes to you and they have had a lot of loss, so if someone is able to get pregnant, um, maybe quite quickly, but keeps experiencing a loss, what would you recommend for them in terms of testing, in terms of protocol? Is it different for every single person, or are there things that you could recommend to listeners
Mhm.
to look into?
Yeah, so the first question is, do we know if these losses are genetically normal or not? Because that also makes a difference. Because if the losses are genetically abnormal, then we know that it could likely be due to egg quality. And I want to do things to support egg quality and talk to the patient about IVF with PGTA, which stands for preimplantation genetic testing for aneuploidy or screening for abnormal chromosomes. If if the losses are genetically normal, then we want to look at things like silent endometriosis, adenomyosis, endometritis, elevated sperm DNA fragmentation, a uterine septum, antiphospholipid antibody syndrome, and immune issues. If I don't know, so if let's say she's had 3 miscarriages and people said things like, oh, it happens, it's normal, you don't need to know why, which drives me bonkers, then I actually can do a workup as if they're abnormal or normal. And we also want to rule out genetic causes that could be from the parents, so from the egg source and sperm source, and looking at chromosome analysis for both of them. So if they don't know if their embryos have been miscarrying because of being genetically abnormal, then I do the workup as if they could be normal or abnormal.
And I think that it's so nice to hear that there are like the lists are quite long of the things that it could be and the things to look for. And especially here in the UK, it's that blanket. Oh, you need to have 3 miscarriages before we even bother thinking about anything. And obviously, if you're into your 40s, you don't have the time to be getting pregnant, miscarrying, getting pregnant, miscarrying. And
Yeah.
so people really understanding that, like you said, like doing your own research and getting clued up. And this is why I do these interviews and bring people onto the podcast to get this information out there, because a lot of the information we're told by the people that we think have our best interests at heart are maybe just fobbing us off with they either don't have the time, or like you said, or the energy or the capacity or the knowledge to help us, but finding the people that do and the people that are willing to go that extra mile to support you, rather than like I supported one lady who's had 7 miscarriages, and so many times she's just been told, well, at least you can get pregnant. And she's like, well, getting pregnant isn't the problem. get
Right.
get pregnant every second Tuesday, but it's keeping them. So for her it was, yeah, finding the right protocol, finding the support that she needed to be able to go on to that next step.
Yeah, my approach is to prevent recurrent pregnancy loss. So if someone has had 1 miscarriage, and if they let me know, and it's even, I want them to genetically test it. I want to know the reason because it's going to really help me see if there's anything I can do to prevent the next one.
Yeah. And talk to us about, so you have two methods, the Tushy method and the balls method. Talk us through the Tushy method to start with.
Yeah, so the Tushy method is basically my way of easily reminding people how to get your fertility checked. Getting your fertility checked should not be hard. People think that it's this complicated thing, you don't know what to test. And I have patients come to me and say, yes, I had my fertility checked. And then I see the test that they had done. They had like a blood count, an HIV test, and they were screened for rubella. And I'm like, those are not fertility checks. Like, how
Yeah.
do we know what's going on with your eggs? How do we know if your uterus has a fibroid in it? How do we know what's going on with the sperm? So I basically took the 5 things that we do to work up someone who's having a fertility issue. And you don't necessarily have to wait until you have a fertility issue to do these things. You can even do it before you start planning your family, just to make sure that, you're on track to have the number of kids you want on the timeline that you're hoping for. But it's basically the T stands for checking your fallopian tubes. The U stands for getting an ultrasound of your uterus. The S stands for checking sperm. The H stands for looking at your hormones, and we're talking about ovarian reserve tests and also things like thyroid. And I throw in all my preconception labs in the H category. And the Y is your genetic test. So making sure you and the sperm source are genetically compatible. We do an extended carrier screen for autosomal recessive genes. And I also have chromosome analysis on that list as well for my patients as part of my fertility checklist. And then for patients who have a personal or family history of cancer, I also do an inherited cancer gene test as well. So that's basically how you get your fertility checked if you're a woman. And if you're a guy and you see that you have a low sperm count, it shouldn't be one of those things, well, his sperm's really good, it's just slow. It's like, no, we need to figure out why is it slow? What can we do to improve it? And that's where I came up with Ball's method. So that's for guys. So the B stands for background genetics. And the genetics that I'm referring to are tests like sperm DNA fragmentation. If the sperm count is very low, do a Y chromosome microdeletion and a karyotype, which is a chromosome analysis. Looking at the A as the next category of tests is anatomy. So I don't check anyone's balls here. I tell them, not here, keep your pants on, sorry, and have you go see a urologist, and more specifically, a reproductive urologist. So these are urologists who did special training in, like me, an egg and sperm make a baby, and they specialize in the sperm part. So they'll check under the hood, so to speak, do a varicocele check, which is a testicular exam to check for a dilated vein. They also do hormone checks. And if, let's say, the testosterone's low, they can put a guy on medications like Clomid or Arimidex. Then the labs and the lifestyle, those are the two L's. So like I just said, checking testosterone, for example. Lifestyle means cutting out the excessive alcohol intake, cutting out the nicotine, tobacco products, cutting out the heavy drinking. And the S is talking about sex and like what's going on in the bedroom. Like, are there issues with erectile dysfunction? I want to know about these things. I want to talk about it because if there are things that I can do to help, I want to, like prescribing medications like Cialis or Viagra and supplements.
Fantastic. And I feel like everything you've just listed, like now I've been working in this field for 11 years, like everything you've just said, like I know what that is. But while I was going through infertility and actually experiencing this myself with my partner, we didn't know we there were like three of those tests that we were offered. And then we just kept going through treatment and then back for more treatment and back for more treatment. And because I've been diagnosed with endometriosis, they were like, well, that's your problem then. And it wasn't. Or rather, let's rephrase. Who knows? It may have been because I then had both of my kids naturally. But we kept going through this treatment and they then the more years passed and then they were uncovering other things and things on my partner's side and then cysts and all these things. And I'm like, if I look back, if just us as a couple had done those tests a year in, how different our fertility journey would have been. Because
Right.
getting all of the information up front rather than, oh, if there's a problem, then we'll look and see if there's something wrong, which a
Right.
lot of the time but there isn't time to do that. The clock
Mhm.
is ticking and it is like, let's do the test, get the information, then taking the actions to help and moving
Yeah.
you forward.
Totally. There's so many myths too. Like people think just because they're having periods, their tubes are open, because sometimes, people think that somehow their fallopian tubes are connected to the period. So of course their tubes are going to be open. Or he's ejaculating semen, so he must have good sperm, but has nothing to do, that's nothing to, they don't have anything to do with one another.
And I think it's like really looking at testing both partners instead of like I've worked with so many clients whose partners, they were told as a couple, well, your partner's sperm is absolutely fine. And then after they've been through a load of treatment, had a load of losses, then they go, oh, actually, a DNA fragmentation here. And it's like, look, they've just been through 2 years of hell.
Right.
Now you're going, oh, yeah, actually, it's not great. And so it's so refreshing. And I think this is why it's so important as well for people to, you know, everything that Dr. Aimee is saying is like, you don't need to understand all of it right away today, but become familiar with this language, become familiar with what's available and what's out there and get confident. So if people are working with a doctor, so obviously I'm based in the UK, if they're going and a lot of people so it's kind of really split here. So some people are going through the National Health Service and it's the postcode lottery. And sometimes then people are having to go to private treatment, maybe quicker because they've only got one round, etc. And so you're quite limited with what's available and what's on offer. But would you encourage people, even if they were going like through the national health structure or their insurance company maybe only offers certain tests, to go private for tests and split that off from their main clinic?
I would, because, you know, you've heard that saying, knowledge is a power, knowledge is power. The more you know, better things will go. And I always tell patients, test, don't guess. So if you're not getting the experience that you need from the clinic that you're at, It might be worth spending money out of pocket and getting that sperm DNA fragmentation test done, getting that tube test done that they don't think that you need right now. You need to wait another year or 6 months. The money that the emotional, physical toil that you will be saving yourself by finding out early on that, let's say, your fallopian tubes are blocked, that's priceless. That's time and money that you would have spent on treatments that, time off work. Even though you're using your insurance, there's still value in the time that you're spending doing treatments that aren't going to work. So it might be worthwhile to get extra tests done.
And do you work with people in other countries? Like, can
Yes.
people work with you? Yeah.
All over the world, all 50 states. I have my not just my medical license in all 50 states, but I also have insurance, malpractice insurance. So, not that anyone's going to sue me for giving them fertility advice. They better not. But I do have the ability to do that. And it was a lot of work, lots of years, lots of paperwork, lots of exams to get set up in this way. But I'm the only fertility doctor in the entire country that has a license in all 50 states.
Fantastic. And could someone from outside of the States?
Yeah. Oh,
Yeah.
absolutely. Yeah. I have patients in London. I have patients in Australia, New Zealand, Germany, Taiwan, you name it, Singapore. I have patients all over the world.
And what's the process if someone's interested in reaching out to you and working with you? What would be the process that they'd go through?
Yeah, the easiest thing is just to go to my website, draimee.org, and click on the link that said, or click on the button that says schedule a consult. You'll see a contact form there and you'll fill it out. Once it's completed, then one of my new patient coordinators will reach out to you. And it's really important to me that I know everything about you before our first visit because I like to spend a lot of time going through your records, formulating my second opinion before we even meet, so that when we meet, the questions I'm asking you at our first visit aren't, so tell me what you've been through. How many IVF cycles have you done? How many eggs did you get in each cycle? That's not what we're going to spend time doing because I'm already going to know that. I'm already going to know the protocols you were on, the doses of medications, the embryo quality, the PGT results. If your husband saw a urologist, the results from that, I'm going to have that information already. And I'm going to formulate an opinion about what I think your diagnosis is, what your prognosis is, and what the different treatment options are. And when we talk, we're going to talk about your goals, your timeline, your preferences, and values.
In terms of people, um, like you mentioned before, probably already answering this question, but I was going to say, is there like a point that you'd say, oh, wait until you've tried so long before contacting you? Or are you very much like, just if you're thinking about having a baby, reach out?
That's it. If you're thinking about having a baby, reach out because we're being poisoned from the time we're in utero, right? There's plastics in the placenta. So I think we're seeing much higher rates of endometriosis than we've ever seen before. We're seeing lower sperm counts than we've ever seen before. So even if you're in your 20s and you think one day you might want to have a baby, if you're a man, freeze your sperm. If you're a woman, consider freezing your eggs if it feels like it's the right decision for you.
And do you still have your egg freezing parties?
Well, I started them because people didn't know what egg freezing was. And now the word is out. Everyone knows what egg freezing is. So I don't throw the parties I used to do them in private rooms at nice restaurants. And I even used to travel the country throwing them. But now I just do them online. So it's one of the IVF classes that I do. So now I've kind of combined the egg freezing class and IVF class, and I do them online.
And you've got a class coming up quite soon, haven't you? Is that
Yep.
on the
Yep.
16th of
Yep.
December?
Of December. Yes. I used to do them twice a month. And then I found that once a month seems like a good crowd. So I do them once a month now.
And is this a good class for someone if they haven't done any treatment before, or is it like who's
It's
this?
great. It's great for everyone. It's great for people who are new to treatment. It's great for people who've done treatment and it hasn't worked for them. It's good for people who are considering treatment and just have fertility questions because I open it up for a live Q&A and everyone's welcome. I'll be there. I'll stay in the class as long as I need to answer everyone's question. People share their stories. And I just think hearing other people's stories, hearing them talk through what they've been through, it makes you think of your own case and questions that you may not even have known to ask. And now someone's asking, you're like, oh, yeah, I wonder about that for me. And then you'll go back and ask your doctor. So I basically teach people about how to be a really good IVF patient. So they're as educated as possible going into it. So they don't say things like, I can't believe that I had to go through all these cycles to finally figure out what to ask. Right. So I want people to know what to ask about their own particular situation before they even go in and start a cycle.
So that's definitely worth people attending as well, even if they're working with another clinic and another
Oh,
culture.
yeah. Yeah, I would say, I ask all my patients to join a class. I mean, I basically do everything in real time with patients as they're going through IVF with me, but I ask all my patients to join the class if they can live. Otherwise, they watch a previously recorded class and read all the articles, and they can skim through or fast forward through the videos if they want to. And then for folks who work with doctors out of state or out of the country or even in town, but not with me, they also join just to also get my opinion about what I would do in a case like theirs.
And do you find that are you linked in with other doctors, like other doctors coming to you and saying, like, I know definitely with the clients that I'm working with, it's very much like, oh, there's the whole team. So there's like, oh, the embryologists and the genetics and the gynecologists, and there's a whole team. And I think that really is so important when you're going through fertility, realizing that it's not just you and your partner and trying to figure this out. It's okay to have a whole team of people supporting you. And like you said, it's each person you meet, you're seeing them as a parent. And that's the
Yeah.
same as what I'm doing, is like literally coming in and I'm being like, right, how can I support this woman to get to her dream, and what else can we be supporting her along the way? It's always like setting someone up. So it's not just about getting you pregnant, it's about getting you prepared for pregnancy, prepared for motherhood, and off
Yeah.
we go, so you can actually enjoy that experience when you get there, rather than kind of falling out of 5 years of treatment and miscarriages into pregnancy and then being like,
What now?
what is, like, what happens now? It's like we want to be preparing. So talk to me more about the team that you have working with you.
Yeah, I mean, team actually is one of my methods. It's like my method for avoiding one of the biggest risks in IVF, and that's anxiety and depression. So I ask patients to get a therapist, talk about eating healthy, meet with an acupuncturist and see if you enjoy acupuncture. Make sure you have a mindfulness and meditation practice. So those are like big parts of the team that I want my patient to have around her. But absolutely, I work with embryologists, I work with genetic counselors, I work with fertility psychologists, fertility geneticists, and they're definitely all part of the team that supports my patient when she's going through treatment with me.
Taking a quick break to invite you to my next free masterclass. I run these at least every 2 months throughout the year. The next one is on Wednesday, the 5th of March, and this is going to be how to maximize your chances of pregnancy success using the mind body link without having to just relax or stay positive. This is founded in the science backs studies that show by utilizing the mind body link and the subconscious mind, we can not only enhance fertility, but make the road to parenthood so much more comfortable and enjoyable along the way. You can sign up on my website, embracefertility.co.uk. You will also get instant access to my Fertile Thoughts Reset MP3, which in just over 3 minutes allows you to soothe your mind, calm your body, and bring yourself back to reset, which is so important on this journey. So go to embracefertility.co.uk, and right there on the homepage, you'll see a button for free class. Just sign up now, and I'll see you at the class. And I think that's a big thing as well. I've noticed the difference when people are working with you or maybe other doctors, that it's never just, oh, my doctor says this. It is very much like, oh, and Dr. Aimee is consulted with these people, so it feels very supportive. And there's a lot of work I do with clients about them visualizing that whole team so that they can let go. Like they don't need to hold on rather so much because they're being held, and they can just sort of like release a little bit and allow people to hold them and help them and guide them through this, rather than feeling like I need to be in control. I need to be like, holding onto this steering wheel for
Right,
life to get through this.
right.
Um, what have you noticed in terms of if people are getting that emotional support? Like, does that come across when you're speaking to people for consultations, like when they're coming in for tests, etc.? Like, can you really notice the difference?
I can, especially when I give people bad news. When I tell someone, I'm really sorry, I have really sad news for us. The transfer did not work. Your pregnancy test was negative. Those are the hardest words for me to utter. It never gets easy for me to tell a patient that her transfer didn't work and that her pregnancy test is negative. For my patients who are already working with a fertility therapist, they say, Amy, I knew this was a possibility. I was emotionally prepared in case that happened, and I'm going to be okay. And then they ask me, Amy, are you going to be okay?
Yeah.
I'm like, I'll try. I will be, but I'll try for you. I'll stay strong. But that's how I can tell because they're supported. They know that they did their very best. They're not going to beat themselves up. They're not going to blame themselves for it not working. And that's because of all the training that they've done on their mental health. Like they've basically gone through a course with their fertility therapist about how to deal with bad results. And it's really important to think about how you're going to deal with bad results in a way that's not self-harm. So many patients start overeating, they start drinking too much, they do drugs that aren't very helpful for their fertility, then they'll start stacking weight, and all of those things just make it so much harder to get pregnant when we're ready to do our next cycle.
And I think that's such a good point. 'Cause I think some people feel that getting emotional and energetic supports when you're going through fertility is just like the toxic positivity of having like someone there, like a cheerleader going, it's going to work for you, and let's stay positive and let's visualize. And that kind of, in a way, like you just described, in a way, kind of the opposite. Like we're doing that as well, and the visualizations. And obviously, with my practice, we're using hypnotherapy and hypnosis and visualizations a lot, but we're always starting with the coping and comfort techniques first for you to be able to cope with whatever's coming at you, because a lot of the time when you're on a long term trying to conceive journey, there's so much coming at you all the time. And so taking that breath to just go, how am I just going to bring comfort to my body today in this moment and get through today, and then building up to these layers. So I think sometimes as well, people think, oh, mindfulness is just about switching off your, when I first learned about mindfulness, I really wanted it to be like a switch. I was like, if I could just flip the switch of my thought and just go into silence, that would be lovely. When I found out that wasn't the case, I was very disappointed. However, then learning how to work with your mind, and like you said, having those techniques that you know that you're going to be okay. However devastating
Yeah.
it is, this too shall pass. You will come out the other side.
Yeah, and that takes practice. It's not something that we automatically know how to do. Like if you start having a panic attack, you have to have been taught how do you get yourself out of a panic attack? What are the breathing techniques that you're going to use? Who are you going to call? What music are you going to listen to? You kind of have to know that in advance of a panic attack to be able to get yourself out of it. So it's very important to work with someone like you, Naomi, and your patients are so lucky to have you.
Thank you. And this is why it's been so fun. Like when Mary Beth was like, right, dream team, you guys need to talk. Like,
Yeah.
come on. And I
Oh,
think that there's that connection. This is like reaching out to a lot of UK clinics um, to really talk about this stuff. So I ran a talk yesterday with a clinic on Wimpole Street that I was just talking about the power of the mind body link, and how just little tiny changes that the nurses and the embryologists and the even the receptionist can treat the fertility clients, and just changing the language, or doing a little breathing exercise with them, or I taught some acupressure techniques on the call, little tiny things that enhances that journey, and just makes, if you can make the journey for someone a little tiny bit easier, it's going to go such a long way for supporting their mental health and making them feel more supported.
yeah, definitely. Couldn't agree more.
And so um I just had a really good question. It's completely gone, so give me a second.
No problem.
It's gone. It's nearly 1 in the morning. I think I'm doing
You're doing
I think
great.
I'm doing very well. If you could just give like one piece of advice to my listeners. So bearing in mind, a lot of the people who are listening to my podcast have been through a huge amount already. They're either about to just go into treatment, or they've already been in treatment. If there was like an egg whisperer gem of knowledge that you would like to pass on to them at this moment, what would it be?
I mean, it would be my newest mantra that I use for myself, and that is float through life.
Ooh.
So it's
Wow.
really helped me, when I'm delivering bad news or I'm stressed, I just say float and I just think of floating. It makes me just take some nice deep breaths through life. It just reminds me how short life is, and that while I'm giving people bad news, we're all still alive. We all still have each other. So I focus on that with my patients as well. So float through life, that way of living, way of thinking, when someone tells you have a cyst and you can't start your cycle, just think of floating through life, and this is an opportunity for you to take care of yourself again for another month and pamper yourself and be ready for the next ultrasound. If let's say you do an egg retrieval and it doesn't go as well, find those coping strategies to remind yourself what the positives are. Well, we got eggs and we learned a lot about your body, and now we're going to try again. So, float through life is probably the one thing that I want everyone to try and adapt, how to have that float through life mentality. And this is something that you can go to ChatGPT and just put in there, float through life. How can I have that mentality? And it'll give you all the steps, I swear. Um, you can find that there. That you can find.
I'm loving ChatGPT and I keep forgetting it exists. And then my 9-year-old son keeps going, well, Mummy, have you asked ChatGPT? Someone's
Yeah.
like putting the presentation together for the clinic. And I literally was like, as a cognitive hypnotherapist, what should my outline be to a fertility? And it was brilliant. And obviously
Yeah.
I'd already covered, but it had some really good sort of like phrasing. And I was like, thank you, Jasper. That's
Yes.
very handy. Excellent. And I remembered what the question was going to be that I couldn't remember a moment ago. So there's an amazing study that was done in Israel that said that if patients who listen to hypnosis track actually during egg transfer had a higher implantation rate. And so a lot of my clients, they have all my clients have my hypnosis tracks and have the welcoming your embryo home track, which is about 7-minute track.
Hmm.
It's all about inviting the embryo back into your body, welcome it back into your body. Obviously, your eggs have been collected and then put with your partner's sperm and it's been separate to you. So welcome it back in. And we've been working with various different clinics across the world to allow people to be listening to this track actually during transfer. Is that something that people can do with you?
Oh, always. So I actually, a lot of times, not every time, I ask patients what their favorite song is, and I'll play their favorite song. But I jokingly tell them studies show that it's actually the doctor's favorite song, if played, will give them the best chance of pregnancy. And that's actually a true story. So there was a study when I was in training that we took patients that were undergoing their embryo transfer, and we randomized the room to 3 different types of music: doctor's choice, patient choice, and random pick. And believe
Yeah.
it or not, the doctor's choice music actually had the highest, like those patients had the highest chance of
Fantastic.
pregnancy. I mean, I'm not sure how scientifically valid the study was, but I do play music in my office. I do, when patients are stressed, I'll play their favorite song for them. We have a nice sound system here. And so that is something that I believe in. So focus meditation also would be a wonderful thing for patients to choose if, let's say, they're not in the mood for my music.
Yeah. I think the thing is, it's knowing that we can bring all of our senses in to definitely, like when I had my first transfer, it was so medicalized and I really felt like, especially with IU, I really felt like, Karen the nurse was getting me pregnant. That's what it felt like. And it was really kind of like, hi, Karen. So glad you're impregnating me today. It was such a weird situation. Saying anything to make that more comfortable, more connection between the people that are caring for you and being in that space has got to
Yeah,
be beneficial.
definitely.
Fantastic. This has been absolutely amazing. Thank you so much for coming on today. It's been
Oh,
a wealth of information. I'm going to put all of your details in the show notes and underneath the video so people can reach out. But I definitely recommend everyone who's watching and listening to go to that IVF class on the 16th of December.
well,
Thank you
thank you,
so
Naomi.
much.
Thank you so much for having me. It was so fun to talk to you today.
And just remind us for those listening on the podcast of your website and your Instagram handle.
Absolutely. It's DRAIMEE.org, draimee.org. And my Instagram handle is Egg Whisper. If you put Egg Whisper anywhere, you'll find me.
Fantastic. Thank you so much. These are the MP3s that we were talking about in the episode and include that track, Welcoming Your Embryo Home, for IVF transfer. This is a bundle of all of my top visualization, hypnosis, and meditation tracks in one to allow you to guide your body into a deep state of relaxation, to help release fears and negative beliefs, and to guide your unconscious mind towards a clear goal, which is your body responding perfectly to the hormones if you're going through fertility treatment, allowing your body to visualize that conception process if you're trying naturally. And then you have a beautiful 2-week wait MP3 that's welcoming in, inviting your baby in, but in a very gentle way. So this isn't saying, I am pregnant, this is going to happen. If you imagine inviting your friends over for dinner, if you're like, right, I've got everything ready, I've done all the steps, get your ass to mine now. We're having dinner. How does that feel to being invited? Everything is ready. Everything is lined up. Come, we're ready for you. Come when you're ready. That's the vibe of my hypnosis tracks, that these are not demanding, these are inviting, and it's such a different energy. So you can go check these out. Joss above said, I have just done the coping and comfort hypnosis and feel like I'm in a blissful cloud of calm. That is how I want you to go through fertility treatment, or if you're trying naturally, that's the vibe. So you can go check them out at embracefertility.co.uk/store. During the interview, Dr. Aimee and I were talking about a lovely lady, Mary Beth, who has been a client of mine and a patient of Dr. Aimee's. We have both been supporting her for the last few years as she went through many different cycle rounds and losses. Mary Beth made a video for me just before she went into labor with her son, and she has given me permission to share it with you all here today. This video really shows that it's not just about having somebody there to get you pregnant as quickly as possible. Yes, both the intention of Dr. Aimee and myself is to help as many people get pregnant as possible, but actually the support I offer helps people through losses. It helps you make those decisions around what treatment you're going to do next. It helps you be able to talk about things in a safe space, to then go to your doctor, to go to your partner, to go to your other support team with to be very clear and confident on what you've decided that you're going to do, because you've had that space to kind of throw everything up in the air and go, what do I really feel or think about these things? So have a watch of Mary Beth's video.
Hi, everybody. My name is Mary Beth, and I am a client of Naomi's, and I have been a client of hers for, goodness, so long, like 3 years. Yeah, so my journey is just that I have gone through a secondary infertility journey in my 40s, and yeah, I started working with Naomi probably 3 years ago when I was going through my third egg retrieval. My first two egg retrievals didn't work, and then I realized we needed to do something different and I needed a better team. And so Naomi helped me through our last egg retrievals, so many transfers, too many miscarriages to count that basically felt like they were going to break me. And now she has helped me. I'm 9 months pregnant. She has helped me through what has been a high-risk pregnancy, a boring high-risk pregnancy, but high risk nonetheless because of my age and also my history from my first child. So it's really hard to quantify how much Naomi has helped me and supported me through all of these ups and downs. If I could say anything about IVF and pregnancy after loss, is that there is just like so much grief and so much anxiety. And one thing that has been so hard through failed egg retrievals, failed transfers, miscarriages, now being pregnant, has been, how do I calm the intense fears and anxiety that are so loud in my brain, in order to truly deeply listen to my intuition and make decisions? Because as anybody knows, going through IVF or pregnancy or anything else, there's constantly decisions that need to be made, and decisions that feel really weighted and big. And Naomi has been there through every single step of the way. Just like her offerings are not just basic talk therapy, mental health. It is a whole body approach that I utilize every single day. That I've utilized in clinics while I'm waiting for procedures, and now that I'm pregnant, doing the Embrace, the baby to bump, I use every single day, even as I'm preparing to go into labor. Things that soothe my anxiety, calm my body, help me tap into intuition. And not only that, it's not just like a cookie cutter program. It is like she tailors this to you. Every meditation I listen to is like tailored to what my needs are. And she makes meditations on the fly. She sends them to you. She does all these things that are tailored specifically to what my needs are and what is happening in my own brain, in my own body, in my circumstances. She just sees you acutely and intimately and knows you and who you are, and then tailors every single thing she does to you. And it's so there's this amazing talk therapy, there's EFT, there's AMDR, and there's skills and activities, and none of it feels like a waste. It all feels like it has brought me exactly to the point I need to be. And there's always something in my mind of like what I can do to help myself and help my body through really anything. And her one-to-one support is just like incredibly invaluable. I'm somebody who I've struggled to lean on her support as much as I should, and she's constantly encouraging me and helping me to heal that part of me that thinks I shouldn't reach out for help, by her just being available. So I will send her messages about what's going on, and she'll just write back and tell me what I should do and how to help myself. She'll validate what's happening for me. The emotional support is seriously just like unlike anything I've ever had before. And I've done therapy before, and her programs are just like I'm speechless. It's hard to describe. So, anyways, and Naomi is funny and fun, and she's been in a place of where you've been in terms of like no understanding IVF and surgeries and losses, and so she not only gets it professionally, but she gets it personally as well. So, anyways, I wouldn't have been able to get through this time of IVF and grief of loss and a high risk pregnancy without her. I just feel like she has made the experience and one that is empowering for me and healing for me on multiple levels. And so I guess I could have made it through, but it would have been a lot harder and a lot more painful with less healing and less empowerment. So I'm grateful to her, and I hope you will be too.
If you're interested in talking with me about the emotional support that you need right now, then please do reach out. I offer a complimentary 30-minute coaching call for anyone who's considering working with me. We can go through and look at what your goal is for the next 3 months, and not just in terms of your fertility. Yes, fertility is the link, that is my passion, that is the world I love supporting people in. But as we know, infertility can just ripple through into every other area of your life. And this is why I support people emotionally through whatever they're going through. So yes, give me a shout. You can book that through my website, embracefertility.co.uk/coaching, and you can have a read through there of what the one-to-one support packages are. I also have the Embrace Fertility Method, which is my 12-week group coaching course. You can check that out soon. And if you haven't yet done so, then remember to come and sign up for my next free masterclass, which is on the 5th of March. I look forward to seeing you there. If you haven't done so already, please do like, subscribe, share, Share this podcast far and wide. The information shared by Dr. Aimee, I think, is so important to get out there and into the ears as many people as possible. So please do share. And if you've enjoyed this episode, please do leave a review, as that means then my podcast will be shown to more people and spread the word even further.